Good morning. Our names are Lauren Bain, Tabby Curry, and Caroline Robert. For our project, we concentrated on the pressing and often overlooked issue of inequitable access to mental health care in prisons. Through the lenses of race and gender, we will examine this issue to fully represent its depth and severity. By the end of this presentation, our goal is to convince you that the issue is indeed worthy of your support and that it affects every part of our society. The current mental health care system in prisons is abysmal at best. Prison employees' perspectives on prisoners is a self-fulfilling prophecy. They believe they're more likely to commit infractions, and they do because of the poor care that they receive. In the 2004 survey of inmates in state and federal correctional facilities, about 26% of 18,185 inmates reported having a diagnosed mental health condition at some point in their lives. And of that subpopulation, only 18% took medications upon admission to prison. Thus, only 18% received treatment in prison, most likely less. Prisoners with unaddressed mental health issues are more likely to violate prison rules. Thus, the infractions they commit are punished with longer sentences, physical aggression, and even solitary confinement, all of which perpetuate the mental health conditions that they had to begin with. This is an endless cycle that only makes their situation worse.
As Lauren stated above, there is a massive issue with the mental health services for incarcerated people in America. Mental health services for prisoners are consistently deemed less important, yet an estimated 55% of all incarcerated people develop or already have a mental health issue. The issue here is that America has a precedent of incarcerating people instead of examining why they committed the crime. In order to avoid perpetuating the prison cycle, we must get treatment to those who want and who need it. In some cases, this treatment could be within prisons.
So I've included two slides that talk about the statistic of jail suicide rates, out of step with the nation and the U.S. prisons. And then I've also included a slide about the prison healthcare issue and how much it costs per state.
According to the foreign tactics that were successful above, Caroline writes that many countries have prioritized the prisoner's well-being over punishment. As we can see by the figures, America's reoffending rate is 64%, and most of the countries below have half the recidivism rate. They've used methods such as education, work, and mental health care to reduce the number of people returning to prison. About the problem at hand, Caroline states that the problems we are faced with are much more severe than we perceive them to be. Lack of mental health care not only affects the mind, but also your physical health. Affecting a person's daily life negatively is only a minor side effect of poor mental health. There are much more dangerous effects like premature death, heart disease, gastronomical problems, and many more. Mental health support is critical to prisoners to help ease them into society with an ambitious and productive mindset. The brief solutions we've come up with to solve this problem include mandating every state and federal prison to hire one social worker and psychiatrist per 20 inmates, mandate every state and federal prison to designate one room to hold private counseling sessions led by a social worker and supervised by a security guard, and mandate every state and federal prison to require inmates to participate in 1 hour of physical activity per day, which has been proven to greatly improve mental health. Now, we will require all of these mandates to be implemented by 2030, which we think gives enough time to address the sweeping changes we've proposed, though few. We have also discussed another option of only implementing this at the state level to provide the United States with a precedent. A lot of the times the United States is hesitant to change when other countries have done it successfully because the United States believe it can only work unless it has worked in the United States.
So in order to be successful with this, we're going to need influences from both parties. I've examined some different leaders and influences on both sides, and I believe I found some that would back us. David King, who was the former president of the NRA and a former presidential consultant, wrote a piece a few years ago about the issue of locking people up instead of examining their mental state and using mental health programs. I feel by identifying him as a target, we could potentially entice more people from the right. Senator Bernie Sanders has stated his belief in the necessity for prison and police reform. I believe that he has an influence on others in the Democratic Party and would aid to our campaign. An issue that could arise is the great difference in their political beliefs between Mr. Keene and Senator Sanders, which is why we need to ensure a middle ground and make backup targets just in case. I also included some organizations that would help us, the ACLU, which we all know has backed prisoners' rights, the Brennan Center, and then another website that is focused on the addiction recovery, which is also a part of mental health, and it helps them deal with their addiction. And then I've also included another organization, and it just includes statistics about how we don't need to send them to prison and that there's other ways around it.
Another important part of our argument is how not only providing prisoners with mental health care benefits them, but it also benefits you. For prisoners, it improves their health and quality of life for the entire prison population. It reduces stigma and discrimination and helps them better readjust to life outside of prison. For the community, addressing mental health needs reduces the recidivism rate, and more released prisoners acquire the care they need and can enter into the workforce and support our whole community and economy. Since prison staff in the cycle of release and admission and readmission to prison are a part of and affect the broader community, prison should be seen as a public health issue for once.
So a big part of this organization is getting the funding to back it. I believe that I've stated a few different ways, but defunding the police and reallocating this money into the programs would make a lot of sense, and I believe that by putting money into the prison system, we could sort of start to slow down the statistic and lower the re-entry into prisons. I included a chart on here about how much do the U.S. cities spend on policing. For New York, they spend $5.61 billion, and a lot of that goes to the 1033 program and programs like it to get them military-grade weapons. I don't believe that they need all of these weapons, and I think that money is being spent in the wrong place. So by giving this money, or a portion of the money spent on the police, we would be able to fund it to a certain amount. And then I found some grant programs from the past that the government set up, and they were offering $350,000 or more to start implementing programs similar to ours. And I think that we could use those and potentially start ones like that and get donations from organizations. In order to avoid influence, we aren't going to take grants from large organizations who we believe will manipulate it and turn our organization into something that contradicts our original beliefs. So a big part of this organization...
A list of our citations is linked in our presentation, and many of them are linked in the descriptions of each slide. Thank you so much for listening. Have a great summer.